Hi, my name's Angela. I'm a dietitian. I've been a dietitian for 6 years now, and one of my specialty areas is bariatric surgery management. I work at BMI in Joondalup as a bariatric dietitian. So what I'm going to discuss today is my role as a bariatric dietitian and a few troubleshooting things for if you've had a ban or considering having a ban. So a dietitian's role in bariatric surgery is basically to help guide the client through the right type of diet to follow after surgery. Having a band inserted does involve a lifestyle change. It isn't going to do all the work without working with it. So part of my role is to ensure that you're eating appropriately. So we talk about the texture modified diet, which is post-op, and then we talk about how to chew your foods and how to eat appropriately to work with the band to avoid any band complications such as pain or regurgitation. We also look at the right types of foods to choose, because choosing certain textures or certain more liquidized foods over others is a potential trap that you can get into, so you won't lose weight if you're eating a lot of high calorie liquid foods. So we work out a meal plan basically suitable to your lifestyle, to your food habits, to your preferences, and we set some behavioural goals. So that might be eating more regularly, it might be choosing better snacks, or you might be listening to your body and eating slower and whatnot. It's important to realise that the band will give you a feeling of fullness only if you choose the right foods, like I mentioned. And it's also important to, before you continue to have your band filled with fluid, is to just step back every now and then and check, are you following the main rules, which I will explain when we have our sessions. So if you're following the rules then you can have your fills done more frequently and you'll lose more weight. But if you're not following the rules, a fill may not be the answer. So basically what I'm saying is come back to see us as frequently as you are asked to come. If you feel something is not right, that you're you're not tolerating certain foods, first check whether you're eating appropriately, whether you're eating small amounts, chewing them well and eating slowly. And if you're doing all those things, then it's definitely time to come in and have a chat to the doctors. So another service that we offer here at BMI is that if you've had a lap band through this clinic, you're eligible for a cooking class which is run by myself. The cooking class is completely free, and it'll give you many ideas, many hints about how to cook appropriately with the band, because it's about eating appropriately, but also some of your cooking methods might need to be adapted to help suit the band. So rather than cooking a lot of dry food, we might need to look at cooking a lot of moist and wet foods. So in the 2-hour session, it's really quite motivating, and you meet other people with bands and you get to share your stories and learn some new cooking ideas from a dietitian and someone who's personally very passionate about food, so can give you lots of recipe ideas. So you might be thinking, why should I see a dietitian as part of this procedure? Obviously I don't think a dietitian is any more important than the other members of the multidisciplinary team, but working together with the team, I do think it's important to come for several visits post-op as well as one visit pre-op, again just to set the mood and just to really make sure that you're in the right mindset and that you're aware of the changes that you may need to make to your diet after surgery. And then the post-operative reviews are mainly about implementing those changes and making it easy for you to implement whatever changes it is that we've sort of identified. So if you do choose to see a dietitian, you will most likely get better results if you know that your diet does need to improve in certain areas. So please, just to summarise, dietitians are an important part of the multidisciplinary team. Here at BMI, I'm very passionate about bariatric surgery management and guiding the client through the right lifestyle changes after this surgery. Last point I would like to mention is that having a band does not mean the end of enjoying food, having an active social life, eating the foods that you want to eat. It's really more about changing the way you eat food and changing certain types of foods, yes, but you can definitely enjoy a really varied diet and have definitely a full life food-wise and go travelling and do all those things that you want to do with the band. So don't think that it'll be a limitation in terms of the variety of foods that you'll be able to eat, because as long as you're following the main points, the main rules, you'll get what you want out of it.